Thank you for choosing this video on how to analyze a case study brought to you by the Aiken Technical College Library. The material in this tutorial comes from a 2011 presentation by Dr. Brian Logan, biology instructor at Aiken Technical College. Consider the following case study. A 12-year-old female reports to her primary care physician complaining of severe cramping and pain in the lower abdomen and mid-back areas. She's also experiencing a burning pain while urinating. The physician suspects a urinary tract infection. A sample of midstream urine reveals gram-positive, non-capsulated cocci arranged in cultures. These bacteria are coagulase negative. You can use the critical thinking model to diagnose the girl's condition. The steps in the critical thinking process are identify, collect, analyze, develop, and evaluate. First, you need to identify the problem and the question that needs to be answered. In this case, the problem is the girl's symptoms, which suggest a possible urinary tract infection or UTI. Then, the question to be answered is, what is the cause of her symptoms? Next, you need to collect some information. You know that the patient is a 12-year-old female. You also know which type of bacteria are present. After that, you must analyze the information you have available. Do you need more information? What else can you find out about bacteria that cause UTIs? What are some of the common causes of UTIs? Some of the information sources you can use include medical experts, books on the subject, and reliable websites. One reliable online source is the Johns Hopkins Antibiotic Guide, which provides information on various types of bacteria. Note the descriptions of E. coli and staph. The next step is to develop a possible diagnosis. In the Johns Hopkins Antibiotic Guide, you read some characteristics of E. coli. Do these findings match the information from the girl's urine sample? Incorrect. The characteristics of E. coli do not match up with the bacteria in the urine sample. Correct. The characteristics of E. coli do not match up with the bacteria in the urine sample. PubMed.gov is another reliable online source of medical information. Here's an abstract from an article about a strain of bacteria that causes urinary tract infections in young adult women. Staph is mentioned once again. Let's try another possible diagnosis. Could staph, the bacteria mentioned in the two online research sources, be the cause of the UTI? Incorrect. The characteristics of staph do match up with the bacteria from the urine sample. Correct. The characteristics of staph do match up with the bacteria from the urine sample. In the final step of the critical thinking process, you evaluate the diagnosis. In this scenario, you need to compare the bacteria in the lab results with the two major species of bacteria that cause UTIs, E. coli and staph. The information you've collected on staph matches the information from the case study. After identifying the problem and collecting information, you were able to develop a diagnosis. By analyzing and evaluating your findings, you were able to confirm that this young girl's UTI was caused by the bacteria staph. For more information, please visit the library in room 1001 on the Aiken Technical College campus. Thank you.